people, at least at Hanley, talk about being terrified when these new symptoms pop up. And
Hmm.
many times we see this type of use with our older adult patients. And, that makes it even harder because there are a lot of drugs that folks come in using, most of which they're dependent on. Some
Hmm.
of them, blood pressure meds, things like that, they really need.
Right.
And the additional symptoms that you're talking about are just terrifying.
They are incredibly terrifying. In fact, fear and the anxiety tied with that fear is the number one thing we deal with our patients. And also, and it makes sense. There's a physiological response system that goes on, and I can always explain that that actually causes that. One of the things that I got, you mentioned like the stigma, and that's one thing I want to make sure I also mention because I had the pleasure of through grassroots, we co-founded an organization called Benzodiazepine Action Work Group, and it was part of the Colorado Consortium for Prescription Drug Abuse Prevention. So by being absorbed by them and being one of their work groups that I co-chaired with a doctor from University of Colorado, I got to see the opioid world, and I got to see the
Oh,
world of addiction and SUD, and I wasn't as familiar with that. So for 3 years co-chairing that, it was the best education for me because I got to see, hey, what we're going through is dependence, not addiction. Don't call us addicts. It's like, wait a minute, calling addicts as part of the problem in the first place because we're stigmatizing. And that really helped to educate me and help me understand that, like, just as you said, these are both medical conditions and both have to be dealt with respect, with destigmatizing language. So we understand what the people are experiencing. And that's the one thing I want to make sure I emphasize. It's not that I'm differentiating it because I'm saying this is, that's addiction, this is that. I'm saying this is a different condition that needs a different approach, okay,
Right.
than we've done typically with SUD.